You're listening to the Nourish Child Podcast, episode number 109. I'm your host, Jill Castle, and this is a show designed to help you navigate the ups and downs of nourishing healthy kids inside and out. Today, we're talking about teen obesity and bariatric surgery. 5 million U.S. children and teens are severely obese. These kids are at high risk for developing chronic and progressive diseases, including high blood pressure, dyslipidemia, obstructive sleep apnea, polycystic ovarian syndrome, type 2 diabetes, fatty liver disease, bone and joint dysfunction, depression, social isolation, and poor quality of life. Many have already developed these health problems. Lifestyle modification and treatment has achieved moderate short-term success among young children and those with less severe forms of obesity, but no studies to date demonstrate significant and durable weight loss among youth with severe obesity. Surgery in these teens can result in marked weight loss lasting at least several years with few complications. In many cases, related health problems, including diabetes and high blood pressure, vanish after surgery, according to an American Academy of Pediatrics policy statement. One study in children younger than 12 found no ill effects on growth after weight loss surgery. The Academy's recommendations say children and teens are generally eligible for surgery if their body mass index is 40 or higher, or at least 35 if they have related major health problems. I know obesity is a sensitive topic. Child obesity, even more so. Couple that with surgical interventions and things may be feeling a bit uncomfortable right about now. If you haven't listened to my interview with Ted Kyle, which was episode number 108, I encourage you to do so. It puts this interview in context. Before I introduce my guest, yesterday, I hosted a free training called 3 Little-Known Secrets to Raising Healthy Eaters. I covered the big picture of what you need to know about raising and nourishing kids in a more modernized fashion. If you weren't able to attend the training, there are still a few time slots open. You can go to www.jillcastle.com to register. I will also include the link to the registration form in the show notes here. That's at jillcastle.com/109. In my training, you'll learn about the mindset shift all parents need to make, 3 different areas of parenting that make feeding your child easier, the ideal feeding approach that encourages a healthy relationship with food, and what you need to master to cultivate autonomy with healthy eating. I've discovered the recipe that differentiates parents trying to get their kids to eat well from kids who choose to eat well for themselves. And I've shared it in this free training. You can find the link in the show notes to register, again, over at jillcastle.com/109. Okay, guys, let's cue the music.
Welcome to the Nourish Child Podcast, a show about childhood nutrition, feeding kids, and dealing with the ups and downs of growing a healthy child. Here's your host, registered dietitian and childhood nutrition expert, Jill Castle.
Well, I'm very excited to introduce you to Faith Newsome. She's a current college senior at the University of North Carolina and a member of the Obesity Action Coalition. Faith created a small nonprofit organization called Oceans Lifestyles. Its tagline is, "Change is made in waves." She created this to help teens who struggle with their weight. I'll include the link to her organization in the show notes. Faith had bariatric surgery at the age of 16, and she's here to tell her story. Here's Faith. Hello, Faith, and welcome to the Nourish Child Podcast.
Hi, thank you so much for having me. I'm really excited.
I'm excited to have you here as well. And you're still a college student, is that correct?
I am. I'm in my last semester, which I was supposed to graduate in May. When we'll actually have our ceremony is to be determined. But yes, I'm a senior at UNC Chapel Hill now, and then I'll be headed to the University of Florida to pursue my doctorate after I finish up at UNC.
Wow, congratulations. What are you studying your doctorate in?
So my doctorate will be in medical sciences with a concentration in health outcomes and implementation sciences. And I'll be working with Dr. Michelle Cardell. I'm not sure if you're familiar with her work, but my goal is to go into obesity research, and her lab does a lot of adolescent obesity work. So I'm really excited.
I'm so happy to hear that. That's really wonderful. And I'm sure that your life experiences and your interests have all sort of come together with a lot of great purpose, it sounds like, behind it.
Yeah, my weight loss surgery was kind of a catalyst for deciding what I wanted to do with the rest of my life. So I actually showed up to college with a very firm idea of knowing I wanted to go into obesity work and wasn't sure what capacity that would look like, but I've kind of found my way over the past 4 years. So it really started when I was 16 with that experience, which is humbling and exciting.
Yeah. So let's actually begin with you telling us about yourself. I've done your formal introduction, but it's always nice for the listeners out there who are mostly parents and medical professionals. It's always nice for them to hear you describe yourself and your life experiences in your own words. So we know you're a senior at UNC, but what about all those years before that?
Yeah, so I grew up in Stanford, North Carolina, and I am the daughter of 2 small business owners. So my parents work together, and there has never been a time in my life where I haven't carried excess weight. So one of the things that my mom has said is that she picked me up and put me down one day at an abnormally young age and then never picked me up again because I was heavier than most kids who were my age. So my weight is something that I've been aware of for a really long time. When I was in elementary school, I stopped going to field day because the kids would see that I was on their team, and it would cause this kind of, jokes and eye rolls that I was going to lose the relay. And I was a very competitive kid. So knowing that I wasn't a valued member of the team was hard for me at that time. And then one of the instances of weight bias that I experienced at a really young age, this was also in elementary school, was these student nurses would come in and they would take our vitals and measure our height and weight. And I remember getting pulled to the side after they had weighed everybody, and they weighed us all in front of each other, which was problematic in another sense. But they pulled me to the side and they told me that if I didn't start thinking about my weight and working on my weight, that I was putting myself at risk for high blood pressure, diabetes, a long list of things. And they're telling this to an elementary school aged kid. So of course I was petrified, and it was clear to me that I was being singled out for my weight and talked to in this way because I weighed more than the other kids. So that's when I started feeling kind of those feelings of guilt and shame related to my weight. And then in middle school, around 8th grade, I actually had to leave the school that I had been a part of from kindergarten to 8th grade due to bullying. And I switched to the local high school. And the bullying, growing up in an age where phones were becoming popular, it didn't just leave whenever I was at school. So I would get phone calls and people would say things. So we switched schools after that and had a little bit less of an issue, but my weight was still something that was a part of my identity and something that I was very aware of. And I didn't play organized sports and those kinds of things, even though I had the desire to, because going back to those elementary school years, I knew physical activity was just not something that I was physically active in my own way, but I wasn't necessarily that way with my peers due to some feelings of shame and things like that. So when I was 16, my mom actually approached me and said that they had found a program at Duke that would offer adolescent bariatric surgery. She and my father had had bariatric surgery when I was younger. I think hers was in 2004, and I'm not sure when his was, but they were both really successful with it. So I thought that it's something that I would want to pursue, but I figured that I was going to have to wait until I was at least 18. So when she first brought that option to me, I said I would think about it. I wasn't really sold yet. And she told me it was my decision. So if I wanted to pursue it, she would make the appointment. And if I wanted to drop it, we wouldn't speak of it again. So I actually made the decision after my brother had a Science Olympiad tournament at our local college, Campbell University, and the gymnasium that they had it in was built in the 1970s. So the chairs were significantly smaller. And I remember my hips digging into the side of that chair. And that's when I looked at my mom and I said, okay, I'm ready to go to Duke. So that's when that whole process started.
So both of your parents had bariatric surgery. So you had a touchstone or a role model of a real life people who had success with this and were living their lives, successfully after having surgery. That must have helped you a lot.
Yeah, so my mom had it and was very successful. And then a couple years later, my dad had it and he had a lot of comorbidities. So he had the high blood pressure, the type 2 diabetes. And when I was 15, I was experiencing high blood pressure. And I also had the brown ring around my neck that was signifying that I was becoming insulin resistant. So I knew that type 2 diabetes was probably in the near future. And so seeing my dad living with those conditions and then having bariatric surgery and seeing those kind of reverse and resolve themselves, I saw the health benefits. I saw them exhibiting healthy behaviors. I saw the way that they ate and the way that they lived post bariatric surgery. So I feel very blessed that I had a very good sense of what I was getting into. And for younger people, they typically suggest the gastric sleeve, which makes sense. But both of my parents had gastric bypass. And I think because I had so much familiarity with the bypass, that's what I ended up deciding. But I was very lucky to have those kind of models and to see in real life what this decision looked like before I had to make it.
Yeah. I think that probably helped a lot. And I'm curious as to what your experience was with your healthcare providers, from a young age all the way up through age 16. Every year kids go to the pediatrician's office, they get their height and weight checked. Obviously, you detailed sort of your experiences at school. And it's just odd to me that we're still weighing and measuring kids in school. I had that done when I was in 9th grade and I'm in my 50s and we're still doing that. And it's not convinced that there's a big benefit to that. But I'm curious as to your experiences with the healthcare providers that you had throughout your life. Were they supportive? Were they, pulling you to the side and saying you need to do something about this? What was that all like for you?
Yeah, so I don't remember much of my interaction with healthcare providers, but I wonder what information they were giving my parents, because I do remember my mom would go to specialty grocery stores before Whole Foods and Trader Joe's and all of those places were really popular, trying to find these foods without additives and those kinds of things, and putting together meals for me and trying to help me out in that sense. And I remember going to birthday parties and looking up at my mom and asking if I could even have birthday cake because I wasn't sure what kind of diet I was following or what the rules were. So I don't remember exactly my interactions with healthcare providers, but I know, or at least can reasonably assume, that those conversations were happening just based on the great lengths that my mom was taking to kind of help me manage those things. So
your mom, actually, I was doing a little research. I know that you were interviewed, I think it was for a New York Times article about bariatric surgery, and you've got some, let's say, less than positive remarks about making that decision. Is that fair to say?
Yeah. So before the New York Times article, I had been interviewed by the Associated Press when the American Pediatrics Association came up with their approval of adolescent bariatric surgery. And I remember my local news station reposted it, and a lot of people came after my parents. And I remember my mom calling me crying. It didn't really affect me. And I think that's from years of hearing those kinds of comments and then also being active in those spaces now as an advocate and as a researcher. I do see a lot of those sentiments repeated on my timeline. So it didn't really affect me, but I remember she called me in tears and she said they just don't understand how much work that I put in, because they were telling her that it was her fault. And there's a lot of times where people say it's child abuse if a child is experiencing obesity. So after the criticism from the Associated Press and the WRAL reposting and the New York Times, she had a little bit of a hard time working through those comments.
I can imagine, because there's, you're having your own experience of living your life and dealing with bullying or any kind of weight stigma and developing your own sense of self-esteem and your body image and all of that stuff. And then you have your parents, and particularly your mother, because the mothers are always, not that they are always more responsible, but oftentimes it's the mom who is feeling the most guilt and the most responsibility for what her children are going through, whether it's a weight issue or even a mental health issue. Moms feel a lot of guilt. I have to applaud your mom, though, because and I just want to read this quote that she wrote. She said, "Weight loss surgery isn't the answer for every person, and every person has a right to his or her own opinion. But it is also my stance that we must all respect each other in the community of people who have struggled with weight issues. We must respect how each of us chooses to deal with those issues and not be judgmental just because it isn't how you would choose to deal with your issue of weight." Your mom was standing up for you and some of the comments that were getting directed toward you. And I thought that was a beautiful way to show support for you and such a truth. This is a personal issue. Weight loss is a personal issue. And what I want to sort of dive into in a little bit more detail, because I know there are parents out there listening who may have a child who is struggling with their weight. I wanted to kind of dig into what was the process of preparing for bariatric surgery, including, emotional preparation, physical preparation. What were sort of the details around that for you?
Yeah, so for us, we lived about an hour and 15 minutes away from Duke. And the rules of the insurance company, I believe, and just in general, the process is that you have to go once a month for a year to kind of document those weight loss efforts before you can be referred to the bariatric surgeons. So I started my sophomore year of high school going to those. So each month I would take the full day off of school because it's an hour and 15 minutes up there. And then I had to meet with a physician, a dietitian, and a licensed clinical social worker at Duke Healthy Lifestyles. So I really grew a bond with them, seeing them every month for a year. And then at the end of a year of those appointments that were documenting that, weight loss had been attempted and that they felt that I was prepared for the next step, I then got sent to the Duke Bariatric and Metabolic Surgery Center and had to meet and go through the traditional testing that all bariatric patients have to go to. So I was going to the introductory groups with people who were in their 40s and 50s. So it was definitely an interesting dynamic being the youngest person in those spaces, because when I was going to Duke Healthy Lifestyles every month, I was surrounded by other kids. And then when you get sent to the bariatric center, suddenly you're an adult and you get treated like an adult because you are making a big decision. But I just remember that interesting dynamic and the fact that they were asking, how do I prepare meals for myself and meals for my family? And how do I balance this and that with, taking care of a family? And I was wondering, how am I going to drink my protein shakes in class? Because technically we're not allowed to have anything besides water. And how am I going to have enough water throughout the day for this kind of thing? And how am I going to navigate the lunchroom? So those were the kind of questions on my mind that I wasn't speaking up about because I was like, this is only relevant to me. But it was just such an interesting dynamic in that space.
Yeah, for sure. Yeah, those are very practical questions that I would imagine would be really important to understand how to manage. You mentioned that you met with a dietitian beforehand. Were you placed on a diet in terms of, your weight loss efforts, you said? What did that look like specifically?
Yeah, so Healthy Lifestyles has I really like the way that they approach nutrition and the way that they talk about nutrition. So it was more about, making sure you're prioritizing veggies in your diet and those kinds of things. And there's not really off limits foods. There's just foods that you serve as treats and things like that. And so I really liked the way that they talked about it. But up until that point, I had been on every diet you could think of before I went to the clinic. So it was like South Beach, Atkins. If you could name it, I had probably tried it. So it was just kind of getting that check mark box of she's coming. She's, at that point, people know what's healthy and what's not healthy. So it was less, kind of she didn't know and now she knows, but it's more so you have to fill those requirements and, you have to have those conversations. so that they're aware that you're aware and that they know that you're ready for surgery and those kinds of things. But, my family had a general good idea of what nutrition looked like just from years of researching and reading on our own. So we had those conversations with the nutritionist about what we thought, and they, maybe steered us if we were in the wrong direction towards the right direction. And it was just kind of that open conversation and dialogue to kind of check mark that box and say they do understand. And they also talked a lot about what nutrition would look like post bariatric surgery to make sure I kind of understood those things as well.
And when you talk about, going on different diets, how did those work for you? Could you sort of, I think a lot of people recognize that, ongoing dieting probably in the long run does not work. The research shows that it really doesn't work. But a lot of people do participate in dieting with an effort to lose weight. And I think if you have a lot of weight to lose, it's really hard to imagine how you're going to do it without being on a diet. But I'm curious as to, when you look back on all those dieting efforts, what would you say wasn't working?
So I think for me, the problem is it had been ingrained in me for years and years and years that if I tried hard enough, that I would lose the weight. So I was doing what other people told me worked. So if you tell me I'm not supposed to eat carbs and I can only eat lean meat and veggies, is the Atkins and low carb people kind of talk about, then that's what I was going to try to do, because I believed that if I tried hard enough, that it would work. And of course, as soon as you lose that weight and then go back to introducing carbs, a lot of it came back. So I think the problem is I wasn't recognizing my obesity as something that was medical. I was really looking at it as a flaw of, not having self-control. And so for me, what going to the clinic did for me and what having bariatric surgery did for me was it showed me that obesity is a medical condition, and that the same way that people with asthma have to use an inhaler, there are certain things that I'm going to have to do every single day that might be different than my peers that I need to do to manage my obesity. So suddenly healthy eating became less of a punishment and more of this is something that I do to, kind of work with my condition. And physical activity became less of a punishment for my body and more of this makes me feel good, and this is a way that I manage my obesity. So what medical care did for me in the realm of bariatric surgery was showed me that this was a medical condition, and everything I'm doing is not punishment because I have a lack of self-control, but it's a way of managing my medical condition that is necessary whenever you have a diagnosis like obesity. And that might be different than your peers. And so that was something that I really had to digest too, is my friends might not have to worry about this. And that's because they don't experience obesity and you do. So kind of processing that from my experience with the clinic was really helpful.
I really love the way that you just described that. And I hope that parents really pay attention to what you just said, that obesity is a medical condition and we to treat it like a medical condition, not a failure of eating patterns or unhealthy lifestyle behaviors. Because when you do say it's due to your eating patterns or your unhealthy lifestyle behaviors, it just opens up the whole stigma and bias and shame and blame that's counterproductive, quite frankly.
And it makes all those things feel like a punishment. It makes healthy eating feel like a punishment and physical activity feel like a punishment when those things can actually be enjoyable and fun once you take away that stigma and that bias and that self-blame.
Mm-hmm. Now, after you had the surgery, what was your recovery like? How long did it take you? Did you have complications? Anything like that?
Yeah, so surgery went completely fine. I spent the minimal amount of time in the hospital. It's funny, I actually remember very clearly a Ruby Tuesdays ad came on during my time in the hospital, and I literally thought that I was going to throw up. So it was very interesting to see that immediate impact right after. But I came home and rested and recuperated a lot at home. My mom was very worried about blood clots in my legs. So about every hour on the hour, she would make me get up and take a lap around the house. And then I was back and ready to go about 2 weeks after. And I had my surgery in, I think it was July. It was either June or July. and I was playing on the school's varsity tennis team by August. So by the end of that, I
Wow.
was up and ready to go and really putting myself out there. So
Wow, that was fast, huh?
yeah,
In
and it
terms
was
of your physical exercise and activity level.
yeah, so I was expecting, the recovery to take a little bit longer, but, with the way that they do surgery now, because back when my mom had it, it was a lot more intensive and her recovery was a lot longer because the techniques were just a little bit different back then than they were now. But yeah, I was up and running laps with the rest of the team, and there were no tryouts, luckily. So I just walked up and asked if I could join the team, and they were all happy to have
Yep.
me. But, it was really exciting to, have that surgery at the beginning of the summer. And then by the end of the summer, I was already feeling confident and able to do those kinds of things. So,
Yeah. And what was the return to eating solid food like?
oof, I just remember the time where after surgery, you can just have, I think it was like the size of a medicine cup that comes on the top of Dayquil. So I remember during the first few weeks, it was just protein shakes or water of that. And I think they tell you to get like 64 ounces of water throughout the day. But when you're taking it through that medical cup, you have to be pretty consistent about it, which is
Yeah.
kind of difficult. But it's just weird to think back to that time. And I don't remember too much the transition to solid food, but I remember about 3 weeks after I was tired of, just taking my sips and that kind of thing. But my mom was also very active in finding things because you go from the liquid to like soft foods to solid foods. So I remember my mom being very helpful in figuring out like what we could do, what we couldn't do, looking up recipes and looking up research and that kind of thing.
Mm-hmm. And then what was your weight loss experience like, Faith?
So it went really quickly. I remember going to each appointment and they'll be like, there's 10 pounds gone, 15 pounds gone. And it went very, very quickly. And then I got to my lowest weight a couple months after prom, I want to say. So junior year prom. But I mean, junior year prom was an experience all of itself because by that time, that was April, and I was able to go to a prom dress store and try on all those dresses after years of ordering my clothes online. So that can speak to kind of the weight loss that I experienced there. And then I did lose a significant amount by the next summer, which was like my lowest weight. And then I did have a little bit of a rebound. And then I did go to college afterwards, which a lot of people experience weight gain during college. And I also experienced weight gain during college. It was a little bit scarier for me because I had worked all those years and worked all that time after my bariatric surgery. But I kind of leveled out during my sophomore year of college, and I've kind of stayed at that consistent weight. And there are times that I go up and down because my obesity is something that I still have to manage. And just because I had bariatric surgery doesn't mean that it went away. But
what do you mean by that?
So I think the fact that I had bariatric surgery at a young age, I do think that I was ready for it. But I also think that there was a little bit of naivete in the fact that I thought I was going to have this magic surgery. And then I thought that I was going to be like my friends. And then there was a realization that that was not the case. And so when I had bariatric surgery, I kind of got introduced to this world of weight loss surgery advocates, a community like the Obesity Action Coalition. And so that's where I kind of learned that obesity was a medical diagnosis. So it really took until then where I realized that, and that was my first or second year of college. So I'm constantly learning every single day. And I learned very quickly that, you still have to maintain those behaviors, which I had a pretty good sense of when I had surgery, that I was going to have to take the vitamins and be really particular about my protein intake and that kind of thing. But one day I just woke up and it occurred to me that this is never going to go away. And although there are days where I wish that my weight wasn't something that I have to worry about and where I get kind of annoyed and frustrated that I have to think about it so much, it was that realization that I do have to think about it that kind of empowered me to start having conversations with my friends, especially in college, where they would ask to go out for pizza after we went to the library, or, ice cream after a basketball game. And I would have to explain, sometimes I say no, not because I want to be annoying, but because, I have to take these certain precautions and I have to think about things this way. So I kind of got empowered to have those conversations, but it did take me a little bit.
Yeah, I mean, I think that how you describe it as a medical condition that you'll have for the rest of your life, something like diabetes or food allergies or gastrointestinal disorder like celiac disease. I mean, when you start to think of obesity in that manner, it doesn't go away just because you start to take medications. You're actually managing the disease. And you're right, you will have to manage obesity in terms of your eating, your exercise, your medications, your supplements, all of that stuff for the rest of your life. But boy, it sounds like there are a lot of benefits to having bariatric surgery for you. What would you say were the top 3 benefits?
So I would say that top 3, number 1 would be my college experience was significantly different, and I'm very thankful for that. So I was a part of 5Ks, and I was physically active with my friends, and I wasn't scared to be that way. So I know that if I hadn't have had it, I probably would have been very nervous to go rock climbing on rookie night at the Student Rec Center. But because I had those experiences, it kind of gave me the confidence. And that's not to say that in the middle of a 5K when all my friends are zooming past me, that those feelings don't come up. But I definitely was more physically active in college than I probably would have been otherwise. And that was really good for me. Number 2 would be that I got introduced to a lot of people who get it. So once I kind of opened the door to talking about my experiences and being open about my bariatric surgery, because I had an option when I came to college that I could have not told anybody. I could have kept it a secret. And I know that some people do choose to do that because it's a very personal decision. And once I decided to start talking about it, I was amazed by how many people in college struggle with their weight and feel like they can't talk about it. And so I kind of built a community through that as well that made me feel a lot less alone once I learned that I wasn't the only one experiencing those things. So it really kind of started opening the door to those conversations. And finally, I would say that it helped me feel in control of my body. So I felt at war with my body for a really, really long time. And bariatric surgery is kind of what gave me the mind-body connection where I finally felt like, okay, I'm living in my body. We're on the same page. I'm not constantly fighting it anymore. And it just made me feel comfortable in my own skin and confident in my decision-making skills. And just overall, I finally felt like me and my body were on the same page after years and years of fighting and, body image issues and those kinds of things.
Mm-hmm, mm-hmm. Have you worked hard to improve your body image, or has that been something that's just naturally come from having bariatric surgery and living in a different body, if you will?
It's a very interesting dynamic having bariatric surgery because you identify very much with the person that you were at a heavier weight. And, your body is how the world perceives you sometimes. It's what the world sees of you. And so it's really interesting. There was a time that I went to a convention that was for obesity, but it didn't really matter if you had bariatric surgery or if you were on medication or if you were doing lifestyle intervention, if you were doing nothing at all. But I remember somebody coming up to me and asking me why I was there. And I said, "What do you mean?" And they said, "Well, you're thin, you're young, why are you here?" And just to hear that, whenever you identified so long with, the person that you were maybe at a heavier weight was just jarring. And so I always feel like I have a duality of identity in the fact that, I still identify as a person living with obesity. And then there are plenty of people who maybe wouldn't look at me and tell you that they would categorize me that way, even though by BMI, I still am in that category. But it was just a very interesting experience to hear someone say that you're thin, you're young. What are you doing here? So yeah.
Yeah. So you would say that over time your body image has improved?
Yeah, I definitely feel more confident in myself and in my body. I mean, there are still times I'm still 22 years old and I still am really active on social media, and I'm around a lot of young women who talk about their body sometimes in a derogatory way. So it's hard sometimes to maintain my own sense when there's a lot of messaging that is constantly telling you that you should be better, or here's how to lose 5 pounds quick. Being in those spaces makes it difficult sometimes. And even now, during this global pandemic of COVID-19, I see a lot of people posting online about how they're going to come out of quarantine having lost all this weight and ready with their summer body. And so it's hard sometimes to address my own body issue when, as a young woman, I am surrounded by a lot of that kind of messaging.
I think that the age that you're at too, is difficult in general. I have daughters around your age myself, and I think just that social media environment, as you were just describing, and the pressures to be perfectly fit and trim and beautiful and have the latest fashion and shoes. And I mean, there's just so much emphasis on outward appearances. And it definitely, not that it's not that way for myself as a 50-something-year-old mom, but
Right.
I think your 20-year-olds and your teenagers and even probably young adults are all experiencing sort of the intensity of that in a different way than probably the rest of us. So I could see how that the different layers can be difficult to process sometimes. If you had to say there were, and there may not be any drawbacks, but I wanted to sort of balance the benefits question with, were there any drawbacks for you? Do you feel like there were any drawbacks from having bariatric surgery?
Yeah, this is always an interesting question because I would never go back and change my mind. But, food is a lot of the way that we connect with other people. And so holidays are never going to 100% be the same. College was a different experience in terms of, thinking about those kinds of things and telling my friends, no, I can't go get frozen yogurt on this. So, I mean, like things like that, wherever it's, going to a restaurant is more of I have to think, is this going to make me sick? Because dumping syndrome is real. And I remember one time in college, all my friends had ordered insomnia cookies. We were watching something on TV, and I remember I had one cookie, and I looked at them and I said, I need none of you to speak to me for 10 minutes. I'm going to go lay on the ground, because that's kind of where dumping puts you, is you just have to you need no stimulus, at least for me in my experience. And so there have been some times where that has happened when I'm out with friends. That's been interesting if I'm not paying attention 100% to what I'm eating. So I would definitely say it affects sometimes those cultural ways that we identify and that we connect with food. So that's the only real drawback that I can think of, is moments like that.
But not enough to reverse your decision, or the benefits, it sound like, far outweigh any drawbacks.
Definitely, because like I said, once you realize that obesity is a condition, and however you choose to treat it, you're going to have similar kind of recognition. So even if I had chosen to go with medication or just lifestyle interventions, everything I just mentioned besides the dumping syndrome is something that would be a consideration of mine. So I would never go back and choose not to go with the treatment plan that I chose to manage my obesity.
Mm-hmm. Now, after bariatric surgery, have you experienced any, I don't say bullying, but, stigma or bias towards yourself for choosing bariatric surgery as a teenager?
There's definitely some schools of thought who don't agree with bariatric surgery for younger people. A lot of the comments that I've seen have been, did you ever think about, changing what you eat? Or have you ever thought about just being confident in the body that you were in? And my response to the latter of those responses is that I did love my body the way that it was. Of course, I at times felt that it was working against me, but I did appreciate who I was as a person at that size. But I wasn't willing to undergo, high blood pressure, diabetes. And so I chose a treatment option that was good for me. And I think that adolescents should have that option if they meet the criteria that's necessary. And so it's hard sometimes to deal with people who don't necessarily agree with my decision, because I'm young. I should have just kept trying other ways to lose weight. So that's another popular way of thinking that I see is, well, you were young, why didn't you just keep trying? And it's like, after, trying my entire life, how much longer do you want me to wait before I can get the help that I really need?
Yeah, and how much time do you want to put your life on hold, in terms of experiencing what you're experiencing now, which
Right.
you weren't able to experience earlier?
Right. Because I did get whenever Ted Kyle allowed me to write a post about my experience, there was someone who commented saying, like, I can't help but feel, and I'm paraphrasing here, but that you had bariatric surgery, to wear a pretty prom dress or something like that. And I tell that story because that's an experience that high schoolers have. Like, prom is a big deal to someone who's 16 years old. And did I have bariatric surgery so I could fit into a prom dress? No, but I definitely had a much different, I would argue, less stigmatizing experience because of the decision that I made. And so it was hard because some of the things that were important to me when I was 16, there was the physical activity component, there was the health component, but I'd be lying if I told you that it wasn't really rewarding for me to go prom dress shopping with my friends after having breakdowns in dressing rooms before and things like that.
Of course it was. Of course, every teenager wants to do all the teenager things. And so I can completely imagine that it was very rewarding to be able to feel that you could do that again. When you think about these comments like bariatric surgery is a quick fix and the easy way out, people with obesity should put down the food and put away their devices. And you mentioned earlier, if a teen has severe obesity, they're a victim of child abuse. What do you think those comments say about our attitudes as a culture, as a society, about obesity as a condition and getting help for it?
Yeah, it's interesting you mentioned the devices one, because I remember that one very clearly was a response to one of the articles that I had been a part of. And I was living in my sorority house at the time, and I said, well, if they had only told me, I would have thrown all my devices out the window. Like, I just wish they would have shared this knowledge with the world. I said, exactly, you had the solution this whole time, and there's millions of adolescents struggling, and you kept this information to yourself. So sometimes I have to joke about it because it's funny. And my friends thought it was funny too, because they hear me talk all the time about, the complexities of obesity. And that's my answer to your question, is that we simplify obesity so much to the point that people think that if you eat less and move more, that you will lose weight. And I'm not sure the answer to figuring out how to change that school of thought, because there's been enough research done that shows us that it's significantly more complicated than that. But those comments are just a reflection of, we put it on the person experiencing obesity to figure out their problem and fix it, when in reality, if you were diabetic, or if you had asthma, or if you had, any other medical condition, you would go to the doctor, you would put together a treatment plan, and then you would pursue from there. So we don't have that same kind of idea with obesity, because we're still stuck in this school of thought that says, well, if they ate less and moved more, then we really wouldn't be having this problem.
Well said. What would you say to parents out there who are living, with teenagers or even younger children who are struggling with their weight? How would you ask them, or how would you teach or suggest young people respond to this type of bullying or stigma or bias?
That's a difficult question, just because the easy answer is to ignore it. But of course, whenever, it's consistent and it's constant, then that can be difficult. But if you can find a group of people who understand, that has been what's most helpful for me, because to this day, I still experience weight bias comments, because even though I have lost a significant amount of weight, I'm still in the obese category based on my BMI. So, there is a little bit of stigma that I still experience, and there are still comments that I experience. But luckily, I do have that group of people that I approach and I talk to who know what I'm going through. So there are a lot of different resources to find people like that, but it can kind of ease the sting of people who don't get it when you have people who do get it.
And you've really created that group of people for yourselves through your organization, Oceans. Can you tell us more about that in detail?
Sure. So Oceans stands for Outreach, Community Engagement, Advocacy, and Non-Discriminatory Support. And we are a support and advocacy group for adolescents on their weight management journeys. So whether they are pursuing bariatric surgery as an adolescent, or maybe they're taking medication, or they're doing a lifestyle intervention, or they're doing nothing at all, we kind of serve as a safe space for them. So the way that we do that is through 3 different areas of programming. We work on some policy-based advocacy work. So we have someone kind of working on a research study right now that's hoping to assess bias in schools and ways that we can improve and inform policy in that channel. Another thing that we do is an annual fundraiser, which we were planning for coming up soon, but we will be delaying due to the current circumstances. But that is to raise money for continued obesity research for adolescents specifically. And then the last thing we do that's kind of the heart and soul of our program is what we call socials. So we put together a curriculum that's been reviewed by some clinicians who work with obesity management. And we have a program that's specifically for patients who are pursuing weight loss surgery, because like I said, whenever I was in those spaces with adults, they were having very different conversations than I would probably be having. So we put together a curriculum specifically for them. And then we put together a curriculum for teens who are pursuing other avenues of treatment. But we meet once a month. Right now, we actually have one scheduled for this weekend. So we're hoping to reach out to the 40 pediatric weight management clinics after we are working on our own app development that we can host that programming through. But we do everything online so that it's accessible and affordable, because we know that it's hard enough to get to a clinic that offers weight management services. So we don't want support to be kind of another thing that's difficult to find.
That's great. And you opened up that organization in 2018, and I assume you're going to keep going. Do you have a group of people that work with you in the organization?
Yeah. So right now I have a group of 6 or 7. I can't remember the exact number, but it's UNC and Duke students who work on this project actively with me. So we have a meeting every week. We're working on projects all the time. So there's a lot of us working on it. And we just actually filed for our 501c3 status. So it's something that we're definitely going to continue post-graduation and beyond.
When we think about parents out there who have those teens or children with obesity, what do you want them to know? How can they best support their child?
I get this question a lot. Nobody knows your kid better than you do. So I would feel out that conversation, how they're feeling, because I remember my mom talking to me about my weight. And of course, I didn't need her to tell me that I was overweight or that I was bigger than the other kids. Those were all things that I was aware of. So it really has to be a collaborative effort and meet your kid where they're at. You know, some of them are going to be more ready for things than others. So one thing I know that they do in the clinics a lot is motivational interviewing, which just means that instead of saying, you know, we're going to work out an hour every single day, it's finding out where they are and what they're willing to do. So maybe it's, you know, taking a walk around the block after school, or, you know, however you want to do that in terms of nutrition, but just being really patient and kind and figuring out where they're at will go a long way, because they already know, you know, that they might be experiencing that. They might already feel some of that stigma. So they don't need to be told that they have a problem, and not necessarily saying that that's where all parents go immediately with that conversation, but having an open dialogue with your child about those kinds of issues is super important. And, you know, ask them how they're feeling, or if there are comments at school, you know, addressing and working through those and talking about that with them so that they know that they have an outlet to express maybe some of the things that they are hearing at school or even on TV, because we see plenty of instances like Bill Mayer's comment where people say things about individuals living with obesity. So just always keeping the conversation open and the dialogue there, I think, is important.
For many parents out there, it's fair to consider the fact that your child probably is being bullied on some level, or is taking some of those comments that might not be directed at him or her, but are out there and that can still be very hurtful. So, Faith, thank you so much for sharing your story. I think what listeners are really going to get out of hearing from you is just the, you know, what it's like to have bariatric surgery, and, you know, how you came to that decision and what that process was like for you. But I think they're also going to hear a very well-spoken young woman who is using the research and the evidence to help other teenagers and really make the best purposeful life for yourself. And I'm just really pleased to have you on the show and pleased to know you. And I hope that someday we can meet in person. Where can people connect with you should they want to reach out to you?
Yeah, so I have a Twitter where I'm really active talking about these kinds of things, and that is at Faith_Ann. The Faith has 3 H's, so it's FAITHHH_Ann, ANNE. And then they can also follow Oceans Lifestyles and reach out there. So Twitter, it's at Oceans Lifestyle without the S. Facebook, it's at Oceans Lifestyles. And Instagram is at Oceans Lifestyles. And you can reach out on any of those platforms and it will get to me or someone else on the team that can get it to me.
Well, thank you so much. I can't wait to share this interview with everybody. And I wish you all the best. And I hope you are able to walk for graduation.
Thank you so much. This was fun. Thank you so much for having me.
You're very welcome. Take care, Faith. Well, I think Faith is an inspiring, brave young woman. I hope you enjoyed listening to her story and, more importantly, this 2-part series on child obesity. Remember, obesity is largely genetic. The environment, in many ways, brings it to the forefront. Obesity is a health issue, not one of willpower, and not one that can be simplified into a food or exercise issue. It's a medical condition and needs to be cared for as such in responsible, compassionate, effective ways. I'm sharing a few additional links to shows and articles in the show notes, including that AAP policy statement on severe obesity and surgery in teens. You can find all the links over at jillcastle.com/109. As always, I appreciate that you choose to listen to this show. If you have a chance to rate and review it, I'd be so grateful. Hop over to iTunes or the app on your Android to do so. Until next time, be sure to give that child in your life, no matter his weight, shape, or size, extra loving squeezes today. Bye for now.
Thanks for listening to the Nourish Child podcast, where the #1 goal is to help you grow a nourished child inside and out.